The meetings. We had quite a few meetings with the staff when we were in Keneperu. In fact, I think most of the staff really hated my husband by the end of my stay because he was advocating on my behalf all the time. So one of the meetings we had was with the charge nurse of Ward 7, the person that does the training for Ward 7 and the head physio. And so that was when we discovered that the head physio said to us that it wasn't an intense rehab situation, it was just rehab, but not very much of that. And it was because of, basically it was because of cutting of costs, and that's why there wasn't rehab in the weekends. She did say to me that I'd had more rehab than most people, so I'm supposed to feel good about that, but I don't. And one of the other things was that I said to her, I wanted more rehab right from the start, and she said there's no evidence that lots of rehab affects your long-term outcome. And I said yes, but we'll never know now, will we? Because I wasn't given the chance to have it. So that was one of the meetings, and in that when she left, we talked to the charge nurse and her the person that does the training, and we talked about the awful carer who left me in the shower and the state of the place, etc. And they said they'd do something, they'd see what they could do. But when I talked about the cleaning, the charge nurse said to me, that's out of my control because it's an outside company who do the cleaning. Spotless, they call it Spotless. And I said to her, but you're the charge nurse, this is your job, that's what charge nurses do. They make sure that that the ward is clean and well run, and the staff look nice and present well. And she wasn't doing any of that, so she's getting a big salary for doing not much at all, I have to say, including things like, and the staff can wear whatever uniform they like. Some of them wear scrubs and some of them wear white uniforms, but most of them look really untidy, and that's just another thing. There's no pride in their work, and there's no pride in the place that they work in, to be honest. So we had that meeting with them, and then just before I went home, the Monday before I left, we had another meeting with the charge nurse because the person who did the training was away, and that was to find out what had happened to the person, the evil, the bad carer who did all those things to me. And the charge nurse said to me, oh, now, we've talked to the carer, she's really sorry that she left her in the cell so long, but that was because she was busy and she knows now not to do that. But she hadn't asked her about the other incidents, not leaving me in wet pants and stuff like that. And so I felt that she hadn't done anything at all, and I don't know whether that person had any extra training. I think the only thing that happened was that she was told to keep away from me while I was in hospital. I think that's what their idea of extra training is. We also had a meeting with the principal nurse of blood and cancer services, and we told her all our concerns, and also that meeting was because we complained to the Health and Disability Commissioner and also the Ministry of Health, and so she had to meet with us really, and we told her all our concerns. And since I've gone home, I've had a letter from her where she's addressed all our concerns, but basically she hasn't really addressed them at all. She's just said things like nothing about that nurse, and she's just said things like one of the things that the charge nurse had done was about the lack of engagement of the staff. She'd given all of them an article to read about nurses who are engaged with their patients and nurses who aren't engaged with their patients, and it had culminated in some vigorous discussion amongst the staff. Well, that didn't translate into the staff being any better. So basically I feel like really let down by all of those sort of people. I feel that nothing was achieved. And the reason that I'm doing this video is because I don't want this to happen to other people. You need to know before you go to Keneperu Hospital, if you've had a stroke, that you're not going to get rehab, and that you're not going to get very good care at all, that you're going to feel, and that includes things like you can't have a shower every day. I had a shower every day because I was insistent that that happened, but everyone else has a shower every 2 days. And that's terrible when you're in bed and you feel yuck anyway, and then on top of that you can't have a shower every day. The fact that I had a shower every day caused lots of problems, and you know, it wasn't till the last week or so when it happened automatically, because up to then I had to ring every morning and say, when's my shower? You know, so all these things make you feel really awful and just make you feel that, you know, it's bad enough that you've had a stroke, but all these things on top of it just add to your sense of hopelessness and loss, actually. Now, I just want to mention the doctors as well. Now, I had my doctor, the person in charge of my care, whose name I can't remember, so Lee will have to tell you. We met with her in the 7 weeks I was there. We saw her 4 times. Well, I saw her 4 times, plus one meeting with her when we had a family meeting when they were planning my discharge. The first meeting I can't remember anything about. The second meeting was at our request, and we requested that we talk to her not in the 4-bedded room, but somewhere else, because we wanted to ask her questions about my treatment. And so we had that meeting in her office, and we said to her we weren't happy with the level of rehab and that, and she said to us, well, nor am I, this is just the way it is, and you know, if it was in Australia you'd get rehab, you know,
frequently.
In Australia it would be every day of the week, and it would be 3.5 hours every day, and in America it would even be more than that, but we don't get that here. And she seemed really beaten down by the system and really negative, and just like she's given up, and I think that's terrible, because that's terrible for the people who are under her care, because that feeling that she gives you of feeling like she's given up transfers to you. So that wasn't very good. Now, the doctors on the whole, what they do is they come round and they pull the curtains around your bed and they say, is there anything you want to update us about today? We don't really want to update how you're feeling when there's 3 other people in the room and all their visitors. So I always just say, no, I've got nothing to say. And then they'd go to the next person and pull the curtain around the bed, and you could hear everything they were saying. So if that person was having trouble with their bowels or something like that, the whole cubicle heard. And I think that's really wrong. In fact, it's against the code of patient rights, because you're not given any privacy. And I think that's something that really needs addressing, because it's bad enough that you're in the situation you're in without having to spill your guts in front of all those other people. So that was another thing that was which was really off-putting and terrible about the time in Keneperu. So when we come to my discharge, first of all, when you get discharged from Keneperu and you go home, you get discharged to the community team. So that's the community physio and the community OT and the community speech person. But you don't meet them straight away. You have to have, you know, I'm going to be at home for 2 weeks before I meet any of the team. And I was told that that didn't really matter, because you needed time to get used to being home. But actually what it does is it stops you rehab further because she had 2 weeks with no other input from anyone else, and that's wrong. So that's another thing that needs to be looked at, and you need to be aware of is if you have a stroke, when you go home, you're not going to get automatically, the team isn't going to come and see you automatically. You're going to have to wait to see them because they're so stretched. And so don't expect any very much rehab when you get home. Now, what was the other thing?
The wheelchair?
Eh?
Wheelchair?
Oh yeah, and I just need to talk to you about my wheelchair. Now, I was having a brain biopsy to see whether I had cancer. So I'm unusual in that, and also because I'm under 65. And because my brain biopsy thing is now being looked at by ACC. So I fall between the cracks, and so basically right now no one is funding me. So one of the things was that when I was in Keneperu, I had a wheelchair that was rented through a rental company, and it was okay. Well, I realise now it was fabulous compared to what I've got now, but you know, it was pretty light and easy for Lee to get in and out of the car. But when I went home, I wasn't allowed that wheelchair anymore because I'm not funded for it. So I have to have a wheelchair from the pool of wheelchairs at Capital and Coast. So I've had 3 wheelchairs from them so far. The first one I had was the day that I had to go on to Wellington to have my mask made for radiation treatment, and as Lee was taking me to the car at Keneperu, the foot plate fell off and he couldn't get it back on. So we got to Wellington and we went up to the loan people there and changed that wheelchair for another wheelchair. And then when we got out to Keneperu again, after a couple of days, I realised that this chair wasn't right because I couldn't propel myself in it. So then I got another wheelchair. But the thing about all these wheelchairs is that they're really heavy and they're hard to get in and out of the car. So I'm about to start 6 weeks of radiotherapy, so I've got to go from Paraparaumu to Wellington every day for 6 weeks for radiotherapy, with a wheelchair that's really hard to manage for people who aren't muscle men, basically. So it's okay for my husband to get in and out of the car, but when other people are taking me for my radiotherapy, like you know, women who are, you know, not very big, it's going to be a real struggle to get that wheelchair out of the car and to get me in it. And I just think that's just another thing, you know, couldn't they have made an exception? Couldn't they have given me a wheelchair that's easy enough to handle? That just, to me, summed up my time at Keneperu. Basically, you're just another person that's had a stroke that they just want to get out as soon as possible, and if you make any comments or you want things changed or you are vocal about the lack of rehab or the standard of nursing care, they want you out even quicker because they don't want to have to deal with what you've got to, what you're talking about and what you want to say. And that's how I feel that my time at Keneperu ended up. You know, we had lots of complaints, which I feel were all valid. We were fobbed off. We've been fobbed off in the letter we've had from the Director of Nursing. And now I'm home and we've fobbed off again because we don't have any input from the rehab team for the first 2 weeks that I'm home. And to add to it all, I haven't even got a wheelchair that's easy to handle when I'm having my radiotherapy. And I just feel that Keneperu, it is second rate. It is second rate compared to Wellington. But, you know, it doesn't have to be like that. The staff in Ward 7 all need a rocket, or in fact most of them should leave and they should be replaced by people that want to work there and want to make a difference to people's lives and help people. And there's no rehab, and that's what you really need to take from this video, is that if you get sick, and you end up there, you're not going to get any rehab that really helps and matters, and you're going to end up going home with no rehab as well, and it's just a terrible way to end up. And having a cancer's bad enough, but having a stroke is much worse, and the way that I've been treated and the way other people have been treated in the ward too is wrong. And they haven't complained because they're frightened, because they didn't have such a good network as I've got. And one of the things to finish off with about that is that I transferred from a 4-bedded cubicle. I had my own room for a couple of days, and I'm sure that was to shut me up. And then I had to transfer out of that because I needed that room for someone with the flu, so I went back into a 4-bedded cubicle. And the first night I was there, I was talking to the other 3 ladies in the room, and they said, oh, we will have to have commodes by our beds because the night nurses won't take you to the toilet. And that's just wrong. And I said, no, if you need to go to the toilet and you know it's part of your rehab to learn how to do things like that, then they should take you to the toilet. But these 3 women were all too scared to ask for that to happen because they were scared of the reaction. So all 3 of them had commodes by their beds. And I think that's wrong. You shouldn't have to be like that. You shouldn't be made to feel that you're a nuisance and that you have to have a commode by your bed. These people are here to look after us and to make our lives better. They're not here to suit themselves, and I think that's what's happened at Keneperu, is that there's just a culture of uncaring. Actually, it's a culture of uncaring, and if this makes a difference, I'll be really pleased. But to be honest, I think it's not going to make a difference. I think Keneperu will always is just going to continue to be a place where most of the nurses who are out there, or especially in Ward 7, I'm not against any of the other wards because I wouldn't know, but they are there until they retire, and they don't care about the people that they're looking after. And the rehab staff, some of them are really good, but you just don't get enough rehab. And also they are infected with the thing that says, oh, it's Keneperu, so it doesn't matter, or Keneperu, so that's why we can't get what we need. And so all up, not a fabulous experience for me. And I just finished by saying that I am a registered nurse. I've nursed all my life, and I would never treat people the way I was treated at Keneperu.
And also, we've decided to do this because we're just tired of having to go through all these systems and then, you know, having to wait for essentially nothing to be done. So hopefully people can share this and get the word out, and hopefully we can make a difference.
Yeah.
Thanks guys. Thanks for watching. Sorry it's quite long. Cheers.